So I mainly did chapter five, obviously. That's the one I signed up for, which covered the progressive era for the most part. And a couple of the big things that stood out to me was that there was around 21 or so million immigrants that arrived between the years of 1880 to 1914. And that is a large number in such a short amount of time. So that really stood out to me. It also was really unfortunate because next to nothing existed to protect these people from things such as disease, poverty, discrimination, disability, crime, fire, and terrible, terrible, terrible living conditions. The Depression of 1893 brought widespread disenchantment with corporate tycoons because they were just money hungry and, Americans became very wary about the size and the power of corporations as they still are today, and yet not much has really been done about it if we're being completely honest. Um, there's also barely any social programs, and even the ones that were in place weren't good. The only ones that I could really find were workers' compensation, mother's pension, juvenile courts, and children's bureau. But the mother's pension swept the nation for about 8 years, starting in 1911, and juvenile divisions were eventually slowly put into various local jurisdictions. But then it came about private philanthropy, where workers' comp was widely um, in place by 1920, and the progressive era saw the introduction of services for ex-mental asylum patients because of how cruel they were. 20% of a lot of populations were killed by cholera and typhoid fever and also malaria. Kids were also dying from things like measles, whooping cough, and scarlet fever. There were things put in place like public centers and health inspectors to try and diminish these things. Non government hospitals were funded by crazy fees from the patients that they had to intake, which is still unfortunately in place today with how crazy and stupid expensive fees are. Um, Poor people often went untreated, and they still do today. And there wasn't much government money needed, but still, there was a lot more that could have been done.